Thanks. Thanks for having me here, first of all. Thanks to Growing Family, thanks to you, Sam. And thanks for taking the time to wake up so early and being here on Saturday. So I'm Dr. Vendola. I work for the LWC at London Egg Bank since 7 years now. And we'll try to guide you a little bit towards what it means using egg donors. So the egg donation essentially is the process where a patient decides to use oocytes that are not her own oocyte, but donated from a donor or a bank. And this is because she wants to get pregnant. Now, there are, of course, several reasons why a woman or a couple or a same-sex couple will decide to use donors' eggs, and one of these could be, for example, that they had an impact in their fertility for medical conditions, like, for example, the premature ovarian insufficiency or the early menopause. There might be same-sex couple, they want to have children, or there might be just a patient that had repeated failed cycle of IVF. So several reasons out there. Then we have to face the fact that all around the world there are different definitions of and different type of donation. For example, we have what is called the known and what is the open, which is slightly different, actually. I'll go through with you. Egg donation. So the known donor would be a person that likely it would be a friend or, for example, sometimes a family member, and they would like to help you. Again, because you are in a same-sex couple, because you are a single woman, and again, maybe late in life. So they are people you know. Open donor is likely different because an open donor, for example, in US, it could be somebody that just discloses more information about herself, but still on the non-anonymous. Anonymous donors are a concept that is weird because now in UK we're trying to get a little bit beyond the concept of anonymous. In Spain, for example, or in other countries in Europe, they are quite instead focus on keeping their anonymous donors in the sense they do not want to disclose at the age of later on in life after 18, for example, who is the donor of the gametes. In UK, we have something that is called identity-released egg donation. So, yes, of course, it is considered anonymous because you don't know the face. We can't provide a picture of that. But the child, at the age of 18, it is entitled to know the donor. Okay, so that's the main difference. Non-anonymous donors, as I said, that are usually, for example, in US, are paid. So they receive a compensation for providing the gametes. In UK, it's not like that. They definitely do not receive any compensation for that. Then we have different concepts, as maybe you might have heard about proven donor. So a proven donor essentially means that this person has already had a cycle. So it has a proof that it could donate, okay? So it is resulted in a viable pregnancy, so we do have proof of it. Now, there are a lot of regulation in UK, and they are all under the umbrella of what we call HFEA. So the HFEA is the Human Fertilization and Embryology Act, and with this system, UK try really to give rules in terms of trying to protect the children coming from egg donation at first, and on the other side, the donors. So egg donors are not paid. Not paid. It means they provide this altruistically, okay? There is a token sum they can, of course, get in terms of having a little help for the inconvenience they can go through, but no more than that. On top of everything, since 2005, the HFEA has considered the rule of disclosure the identity of the donor at the age of 18, even for all the donors that had provided their gametes before 2005. So they could be re-registered, for example. The egg donors in UK, but that's pretty similar in US as well, they have no legal rights on the child. Okay, so this is very important. They have no legal rights and no responsibilities. Of course, the patient who received the donor egg will have a counseling. There are fertility counselors pretty much at different stage of the process. We'll go through later, and I'll tell you about that. In UK, there is a limit of 10 families that the donor can help, and patients quite like that because they feel reassured of the fact that you're not going to have your gametes everywhere, but it is regulated with an upper limits of 10 families. Again, the London Egg Bank work closely with the HFEA, and I have to say we've been working for over 30 years with the London Women Clinic. More than 2,500 babies were born with egg donation, and we still have a lot of cycles every month, at least 50 recipients. Okay, so the London Egg Bank really provides the largest section of frozen eggs in UK. Now, the pattern, just to let you know how it works a little bit in terms of what you would expect in this process, is essentially a 3-step process. I have to say that our coordinators are incredible and really helpful, supportive, and always there, trying to accommodate and help in any question in anyhow our patients. So they will be the first face you would see, and they will be the first person to talk and to relate and to ask questions. Then, of course, as a doctors, we are the following step, because of course we need to assess and then recommend you the best treatment. And then, as I said, and a very important part of this, it is the counseling session. So, of course, the process, again, it starts with the preparation of the patient, and the patient need to be ready to receive the embryos. We need to create the embryos. The majority, as I was saying, now of the treatment comes from frozen eggs. So it means we need to thaw, fertilize, and then transfer. So the patient has to be ready for the transfer. There are several ways to do it. We have frozen cycle, or what we could call more similar to fresh cycle, until we get to the pregnancy. Why choosing frozen donor eggs? So from 2017, I have to say that we started focusing, because before we used to do it with fresh. But the results, especially after the vitrification and the cryopreservation, have been so high and so good that there was practically no difference, if not actually on the other side, more success with frozen eggs. And also the possibility to time, the possibility to prepare the woman before the transfer. So in terms of efficacy, choice, and control and timing, that has changed a lot. And this is why, I have to say, in our lab we got 37,000 eggs, and 14,000 are the ones that have already been told. This is just to show you that there is a quite high success rates in terms of cumulative. So it means more than 3 embryo transfer, and we're talking about 74%. That the age of the recipient we treat, it can go from 40ish and 50, and apart from under 40, where of course, and that expected, we get a higher success rate, over 84%, then it is pretty much spread towards the 40ish and beyond. Okay, so these are very high. If you consider that even the survival rate of the towing, we're talking about 93% of the eggs, and HFA normally gives percentage between 60 and 80, so it's really good. Then again, this is just to show you that over the time we got better and better with the frozen cycles and with the vitrification and with the fact that we then have in storage even blastocysts that might be helpful for a second part, for a sibling, let's say, for a future use, we call. Of course, there is still the 4% of possibility that we do not create embryos, and this is out there, yeah. Then this is just to show the difference between fresh and frozen cycle, but again, I told you why, and with the vitrification that we're doing really well, and then towards 2017, and now I have to say pretty much stable. With the frozen cycle, we get really good results. Who are our donors? So the donors comes with a limit age of 35, so 18 and 35. And as much as it can be difficult to believe, but they come because they're willing to help. They're really willing to help. At the point that we have a program that we recently introduced, which is called Freeze and Share, which means that if they want to freeze for themselves, but they have enough to share, they would like to share. And it's just, even recent last week, I had a patient that said, oh, but I heard that if I keep some, and she was in the Freeze and Share program, I can help only, I don't know, 1 or 2 families. She said, I want to donate everything because I want to help more families. That's the kind of people we have. So they come, they don't take money, and they are willing to help. And I'm surprised myself. I still surprise myself when I talk to them. So of course they need to be assessed, and actually they go through a lot. They go through a lot because they have to be screened for genetically and chromosomal disease. They need to be screened because they have all the screening for the sexually transmitted disease. Normally, they are all recruited in UK, and we go through at least 3-generation medical history to make sure that we know everything about them. And again, I'll make you another example. And then I had a recipient, a couple that came to me and said, but how do I know? How do I know if what she's saying is true? And I said, yeah, you're right. The question is fair, but you're passing through me. I'm the person, I'm the doctor who is assessing this woman. So we go through everything. So you rely on me. It's not just you rely on a catalog. There's a lot of work behind the catalog. Now, why they donate, I told you, the majority of them, they want to help. They might come because they have, they themselves in their family, they have struggled. But whichever is the reason that they must have seen, the majority, over 64%, is included in they want to help. The screening, the article, just to let you know, and I kind of said before, they go all through genetic screening, chromosomal screening, they are assessed, and of course they need to be clear for any infection and transmitted disease. They get an ultrasound, they are assessed medically, and they are all also assessed from all the history and the background they have. So there are a lot of information actually in the catalog that we provide, just to show you how easy it is and the 3 steps to follow to choose your donor. We believe that you need to be informed, and this is why it's all in there. It's all in the catalog. So everything is in the medical history. Everything is there. It might not be at the first click, but if you want to know, we're going to provide all the information you need. What we know is like what you will know. That's what we believe. This is a little bit more medical. I don't want to get into this unless you want me to do it on a separate way, but this is just to show you essentially how to choose between 6 eggs, between 10 eggs, what to expect. And of course, there are different fertilization rate and there is a difference in conversion in blastocyst, choosing 6 eggs and choosing 10 eggs. But again, I won't get too medical. Unless you want me to. And the next step is if you wish to meet our team. As I said, the team is made especially from our recruiters. They do the most of the job. They are in first line with the patient, with yourself, with any question you have. They are a link with us. So we trust in them in terms of anything you would like to ask. And we have our desk at the entrance on the right-hand side. And myself, for any medical question, I'm happy to answer.
Great. Thanks, Dr. Vendola. That's terrific. Really
Thank
appreciate
you.
it. Great.